Withdrawn. I call John Blair.
Thank you, Principal Deputy Speaker. Question number 1.
Minister.
One of my duties is to ensure Northern Ireland has timely access to clinically effective and cost-effective medicines, and we do this through a formal link with the National Institute for Health and Care Excellence, or NICE. As Givinostat is a new treatment, routine access in the health and social care system is based on the outcome of considerations from NICE. NICE is currently evaluating Givinostat, and final guidance is not expected until July of this year. Now, there is a route through an early access programme ahead of NICE decisions, but responsibility for participation in those EAPs lies with the trusts. Compassionate use schemes such as this work well for therapies and conditions in which no close monitoring of patients is required. However, when monitoring is required, and that is the case for Givinostat, clinical centres need additional resources, for example, to carry out blood tests and hold additional clinics to undertake this monitoring safely and sustainably. Although medicines under the EAPs are typically provided for free, additional implementation costs will fall to the relevant trust, in this case the Belfast Trust. Having considered the resource required to administer Givinostat safely and efficiently, the Trust has advised it is not able to facilitate this early intervention. Members will be aware of the huge budgetary pressures and saving targets facing all trusts at this time. Finally, it would be inappropriate for me or my department to intervene with the Trust's decision, as this risks undermining our well-established processes with NICE that ensure our population have access to new medicines that have been demonstrated to be clinically effective and cost-effective. Now, should NICE recommend Givinostat, my department will consider it under the usual processes and endeavour to make the drug available as quickly as possible.
Thank you, Minister. Call John Blair for supplementary.
Thank you, Principal Deputy Speaker, and to some extent, my apologies that I'm begging your indulgence to mention my own late brother Adrian. I simply cannot let this moment go without doing that. I recall his diagnosis and his days with Duchenne very clearly, and I remember him with pride and with gratitude for having him as a brother. We have made some progress since those days. I hope the Minister can give us more hope to see further progress in these days. Can the Minister give us any further information on discussions or consultations taking place with relevant groups or representative bodies in relation to this?
Minister.
Well, first of all, I was entirely unaware of your brother, and I would like to pass on my condolences to the member for that. In terms of providing hope, I don't want to provide false hope. It is the case that it is up to NICE to decide whether it is safe to administer or to recommend. The body, NICE, all I can say, it's a non-departmental body. It's sponsored by the Department of Health and Social Care in London. It produces national guidance on the promotion of good health and the prevention and treatment of ill health. They make their recommendations independently, and as I said previously, it would be entirely inappropriate of me to try and intervene with the Belfast Trust to try and expedite the matter, unfortunately.
Call Justin McNulty.
I thank the Minister for his answers thus far. Minister, 12-year-old Nuri boy Alfie Penny has inspired all of us with his impassioned and courageous campaign to raise awareness of Duchenne muscular dystrophy. Access to the drug, Givinostat, would dramatically improve outcomes for children like Alfie. But given your earlier comments, Minister, what action can your department take to actually give hope for families like Alfie's?
Minister.
I'm aware of the young boy that the member mentions, and obviously my sympathies lie with him. However, I have to progress within the rules, within the recommendations, and do so safely. What I can say to the member is that the Belfast Trust provides a regional paediatric neuromuscular service, and that's through the Royal Belfast Hospital for Sick Children, and that would include the boy that the member refers to. While there's currently no cure for DMD, a variety of treatments can help manage the condition. Treatment and intervention is provided within the Royal Belfast Hospital for Sick Children through a multidisciplinary team approach, and that includes specialist clinicians from urology, cardiology, respiratory and endocrinology. Physiotherapists are also involved with the patient's care. and I hope that gives the member some idea of the attention that is paid to young people who are unfortunately suffering from Duchenne muscular dystrophy.
Call Linda Dillon for supplementary.
May I privilege can Corley and thank the Minister for his answers so far, and just want to thank the member for sharing his own personal experience. Unfortunately, a number of families in my own local area of Coal Island also have children with Duchenne muscular dystrophy. Just in terms of, there is obviously a pathway to bring in medication prior to NICE.
Question, Linda.
Can you outline if it's possible that this could be looked at under that guidance?
Well, I thank the member for a supplementary question. As I've said, there is an EAP, but it's only available one of 23 participating so-called North Star clinical centres in the United Kingdom. That programme is a clinical network of UK-wide healthcare professionals who are focusing on the best clinical management of DMD. As I said previously, the Belfast Trust is the regional provider of paediatric neuromuscular services here, so it's the only clinical centre eligible to participate in the North Star programme. Provision of Givinostat EAP is only being offered by the drug manufacturer through the Belfast Trust in Northern Ireland, and they have said that because of the follow-up and the monitoring required, they are not prepared to do it, and I cannot intervene.
Call William Irwin.
Question number 2, Principal Deputy Speaker.
Minister.
With your permission, Principal Deputy Speaker, I'll answer questions 2 and 12 together. So I acknowledge the challenges facing many patients, particularly those not registered with a dental practice, in terms of accessing dental care when they need it. One of the underlying reasons for this is that general dental practitioners are spending less time treating health service patients and more time meeting the strong demand for private work, and as independent contractors they are able to do that. As independent contractors, dental practitioners are under no obligation to register new health service patients, nor does the Department have a role in deciding the location of new practices. That's a business decision made by the practice owners. Access to health service dentistry remains a focus for me and my department, and we are specifically targeting investment this year at improving access for priority groups. An investment package of £9.2 million has supported general dental services in the current financial year. That includes £1 million for newly registered child patients through the re-establishment of the Enhanced Child Examination Scheme, £4.3 million to fund a 30% enhancement to fees paid for dentists for priority treatments, and £3.9 million for the treatment of high-priority unregistered patients through a dental access scheme. There are currently 30 practices participating in that access scheme, 7 of which are in the Southern Trust area, with 2 in Newry itself. Efforts to improve access for all patients will continue to be the short-term focus as dental reform is progressed. And I met with the British Dental Association last month to discuss the issues facing the industry. Officials had a follow-up meeting on investment options for financial year 25-26, and this is targeted at improving access.
William Irwin for a supplementary.
Thank you again. Can I thank the Minister for his response? The Minister has said he has met with the British Dental Association, whose representatives have outlined the concerns around the funding of the service. What action will the Minister take to put in place a general dentistry model that reflects the true cost of the dental care?
Well, I thank the member for this follow-up question, and indeed I meet regularly with bodies who are representative of the various branches of health and social care, and they all have concerns. They have concerns about the budget, they concern about the cost of service, they have concerns about the amount of money that we are able to devote to them. And they are, to fairness, they are all determined to deliver better outcomes. One of the agreements I came to in that meeting was that we would undertake a cost of service survey, because I don't think any of us around that table were particularly aware of what it costs to deliver dental services in Northern Ireland in 2025, and I think that is the fundamental research which gives us the evidence base on which to move forward.
Call Joanne Bunting.
Principal Deputy Speaker, the Minister mentions demand for private practice, but that demand is impacted because people can't People aren't able to register for NHS services. So what can he do to make it easier for people to find out which local dentists accept new NHS patients without having to ring around up to 10 practices to find out what is available in their local area? It's increasingly difficult, and this is a matter of significant import given that NHS dentistry is becoming extinct and people are being priced out of being able to visit the dentist.
Thank you. Minister.
Well, as I said, the dentists are independent practitioners. It is up to them to decide whether they want to take patients, new patients, and register them for health service work. I'm afraid our position is we will provide a list of local dentists to anybody who's approaching the department seeking to be registered with an HSC dentist. And it is for that individual, I'm afraid, to phone around and see if they can get themselves registered. It would put quite an enormous burden, administrative burden, on the department if we were to be doing that for every individual and every family who contacted us with that problem.
Colin McGrath for supplementary.
Thank you, Principal Deputy Speaker. Can I ask the Minister, you detailed to me previously that in June 24 there were 40 whole-time equivalent dentists employed in hospitals across the north, but yet there's just over 1.5 full-time equivalent employed in the Southern Trust. Why is there such a disparity?
Minister.
Well, those decisions are taken by the trusts. I will certainly go away and look at what appears to be a disparity with the Southern Trust. As a matter of principle, what I would like to see is the 5 geographic trusts moving to a point where they have got standardised regional services so that there's no question of a postcode lottery, be it in dentistry or any other part of the health and social care system. So it's an interesting point that the member raises, and I'm certainly prepared to take that one away.
Call Cheryl Brownlee.
Question 3.
Minister.
I thank the member. My department has taken a leading role to prepare the cross-departmental strategy to address long-standing inequalities across our public services. And despite a very challenging financial and political context, my department continues to develop a new cross-departmental autism strategy, 2023 to 28, which was published in late 2023 and make it aligned to legislative requirements. My department continues to deliver against the duties set out in the legislation to develop, to implement and to monitor the autism strategy. Along with the autism strategy 23 to 28, a 2-year 23 to 25 delivery plan was published, and that focuses on the implementation of the requirements of the Autism Amendment Act Northern Ireland of 2022. My department recently published a monitoring report for the first year of implementation. It sets out progress and achievements across government, including the development of guidance for employers in collaboration with the Equality Commission, over 600 staff trained in autism awareness in the Northern Ireland Housing Executive, several actions taken forward via the SEN Reform Programme to better respond to the needs of autistic pupils, including continued collaboration with the Middleton Centre for Autism. Also, the launch of GP training videos to improve equity of access and outcomes, and 2 significant reviews undertaken by the HSC Leadership Centre. The outputs of this work, wider Year 1 progress and the next monitoring report for 24-25 will inform the development of actions and measurable targets for the remaining years of the strategy. It's also important to stress that input from the autism reviewer, Emma Cubitt, will be crucial to informing the next 3-year delivery plan, and work on this is due to commence shortly.
Thank you, Minister. I call Cheryl Brownlee for a supplementary.
Thank you, Madam Principal Deputy Speaker, and thank you to the Minister. I think we can all agree that all we want to do is improve the lives of those with autism. So I just want to touch on what steps are being taken to ensure that sensory-friendly adjustments such as quiet areas, sensory toys, trained staff and better changing facilities are available within the hospital environment, particularly that of A&E, to better accommodate individuals with autism and their families.
Minister.
Well, I thank the member for a supplementary. As you may be aware, following the additional winter pressures after Christmas, I visited 7 of our emergency departments, and certainly one of the takeaways for me was bright light and excessive noise. 2 things which, if you are suffering from autism, would be extremely off-putting. So I believe work is ongoing. Work is ongoing in terms of trying to create an environment which would be much more appropriate for those who are having to present at hospital, and particularly in an emergency department, who are suffering from autism.
Phil McGuigan for supplement.
Minister, what support is available to individuals and their families whilst they're waiting for an assessment?
Minister.
Well, once again, it will be up to the Trust to put in place the sort of facilities that the member is referring to. But the strategy is supported through increased collaborative working across sectors. We have a 2-year delivery plan, and that contains a range of actions, and that's across health, but also education, communities, and the economy, and a range of statutory and independent sector delivery partners. So there is a cocktail going on, and I do believe a cross-departmental monitoring and funding approach is what is necessary. A report has recently been published, and that sets out progress, including the outcomes that have been achieved and how they've been measured. The report also captures funding where possible, which has been allocated to support and deliver the commitments of the strategy. So I believe there is good work being done on that cross-departmental and cross-sectoral platform to try and deliver better outcomes.
Call Donny Donnelly for supplementary.
Deputy Speaker, I would just like to say to the Minister that people with autism don't suffer with autism, they have autism. I would like to ask you just what discussions you've had with the Minister of Education about provision of nurses in special schools.
Minister.
And I take the admonishment from the member that was loose language and inappropriate language from myself, and I do apologise for the use of it. The Education Minister and I have met the principals of a number of special schools in this building. We had a discussion about the issues they are facing. And on foot of that, the Chief Nursing Officer and I have visited at least 2 special schools to see for ourselves the sort of health requirements that some of the pupils who present with pretty severe learning difficulties are experiencing. I believe that community children's nurses have a role to play, and I've asked the Chief Nursing Officer to look at the way forward and to bring forward some proposals at pace.
Thank you, Minister. I call Mark Durgan for supplement.
Minister, you mentioned the autism reviewer, and her appointment is also progress, and she seems to have hit the ground running. However, could you give us some detail on the support, the resourcing and engagement provided to the reviewer from the Department of Health, and if you feel that it is adequate?
Minister.
I'm sorry, did the member say what support the autism reviewer is being given? Yeah. I've had a conversation with Emma Cubitt about support, and the sort of things that she was looking for to get up and running were simple things like a website, like business cards, like access to information and research. I have subsequently had a report back to me that she is satisfied with the level of cooperation that she's getting from the Department of Health, and also, to be fair, from the Department of Education. She's satisfied with the interplay there as well.
Call Brian Kingston.
Thank you. Question number 4.
Minister.
Thank the member. I recognise the vital work that Inclusion Health Service offers to those individuals who are homeless and need access to timely health and social care provision. Like many in the Chamber, I have been shocked by the series of events that necessitated the relocation of this vital service to a new temporary location in Belfast. In that context, it's vitally important a new permanent location is safe for both those accessing and those delivering services. To assist with this, Belfast Health and Social Care Trust has been actively looking for suitable permanent premises. This work has involved engaging with a range of key stakeholders. That would include Belfast City Council, the Northern Ireland Housing Executive, community and voluntary groups, and land and property services, as well as staff and service users of the Inclusion Health Service. It's necessary to get their input on the optimum location for the service. The Trust has also been actively viewing a number of properties, and recently one has been identified as potentially being suitable. Trust representatives are currently engaging with the relevant landlord, discussing potential lease of the property, including any specific refurbishment work that would need to be completed before this could be agreed. Given these talks are currently ongoing, I'm not in a position to provide the member with a definitive timescale for when the Inclusive Health Service will be relocated to a new centre, but I can assure him this will be done as soon as is practicable.
Thank you, Minister. I call Brian Kingston for a supplement.
Thank you, Madam Principal Deputy Speaker, and I do thank the Minister for that comprehensive answer. As you may be aware, the All-Party Group on Homelessness met with the health inclusion nurses 2 weeks ago, hearing about their important work for the homeless and vulnerable people who are not registered with a GP. So I think he's really covered all the points I wish to raise. I'll just maybe ask him just to push the matter again with his officials, mindful that the health inclusion nurses are often in a vulnerable situation themselves.
Thank you.
Delivering
Minister.
the service.
Well, I thank the member for his interest, and I am absolutely prepared to go away and make a further push. And I think it's important because these services are important. The range more or less as before, but reconfigured differently in this temporary accommodation. So service delivery via the mobile health bus, hostel facilities and day shelters is what we're doing at the moment. GP service operating up Crumlin Road, out of hours as well. But what we really want to see, and I think the member agrees with me, or I agree with the member, is we want a new permanent home.
Call Kelly Armstrong for a supplement.
Thank you very much, Deputy Speaker. Minister, when at the same all-party group, we heard from the nurses, and there's supposed to be one inclusion health service nurse in each health trust area, with more in Belfast, obviously because of the pressures. At the moment, we've heard that the Northern Health Trust doesn't have anyone. When will we see a full cohort of these nurses recruited and in place to help people who are homeless?
Minister.
I thank the member for pointing out that disparity, and that, to my mind, is an inequity and a potential health inequality. And therefore it is something that I would wish to tackle, as I've said previously in this session already. While we will, on my watch, I believe, always have 5 geographic trusts, rightly or wrongly, those 5 trusts should be delivering standardised, regional-wide services. And the member is pointing out an area where that is not happening. And I would like to see that addressed. And once again, I will take that away from this session today.
Thank you, Minister. I call Jerry Carroll for a supplementary.
The previous point I said, do you think it's adequate or enough to have one inclusion health nurse in every trust, given that 1 in 32 people are homeless here?
I thank the member for his question. I'm going to answer that much more generally. I think it is probably not adequate for the number of doctors, nurses, consultants in just about every walk of life as we walk through a very complex health and social care system. We need more. Yes, we need buildings. Yes, we need equipment. Yes, we need medicine. Yes, we need funds. But if we don't have an appropriately sized, qualified and motivated workforce, the rest is as nothing.
Thank you, Minister. I call Colin Gilder now.
Question 5, please.
Minister.
It's important for any parent going through the terrible experience of losing a child to have the option of a post-mortem examination to help provide answers about their loss, and that they're fully supported at all stages of the process if they decide to proceed. Members will be aware the current service for hospital-consented post-mortems for Northern Ireland families is provided by Alder Hayes Children's Hospital in Liverpool, and that's been the case since the 3rd of January 2019. Now, my first preference would be the restoration of a dedicated paediatric pathology service here in Northern Ireland. But this remains, I'm afraid, incredibly challenging as these services are under pressure, not just across the UK, but globally, due to a shortage of paediatric pathologists. So I remain very keen on exploring the feasibility of an all-island approach to these services in the longer term that might mitigate the need for infant remains to be transported overseas. I had a number of conversations with Minister Donnelly about the possibility of future cooperation on this issue with the Government of Ireland. I recently raised this with the new Irish Health Minister, Jennifer Carroll McNeill TD, and while at the very early stages of consideration, the conversations I can report have been positive. The Minister reiterated her agreement to take this forward and this will allow the feasibility of an all-island approach to be considered. But I must say that any post-mortem service is likely to take time to develop, even if it is feasible. In the meantime, as these services move to more and more centralised models nationally, and in the absence of any viable alternative at this time, my priority remains to ensure that bereaved parents continue to have access to a high-quality post-mortem service that provides the medical answers as well as the care and support families need and deserve. Access has therefore been secured by a further extension of these arrangements with Alder Hey in Liverpool.
Colin Gildernew for supplement.
And I really welcome that progress, Minister. That was going to be my substantive supplementary, was around contact with Minister McNeill. I welcome the fact that that has taken place and that that is being progressed, given there have been difficulties both sides. Can you outline any type of timeline where that work might be coming to fruition?
Minister.
Well, I thank the member for the supplementary question. That is perhaps the $64,000 question, to which I don't think there is an answer. But I can tell you that I have been working recently with officials in my own department about how we would develop the all-island model. They are particularly keen to look at modern developments, which would include non-invasive procedures. And the first thing we want to do is make sure that the thinking of officials in my department aligns with officials in the Department of Health in Dublin, because this is going beyond post-mortems. Into a broader sense of paediatric pathology. These things, as a member will know, can take time. But the biggest issue, even if we decide that this is the way to go, and I do hope we do, I really hope that we go for the all-island solution, it is the recruitment of a sufficient number of pathologists to service the whole island. In fact, getting enough to service one jurisdiction is going to be a challenge. To do both is going to be not just double, probably treble or quadruple the challenge.
Call Sean Mulholland for supplementary.
Thank you very much, Minister, and thank you very much, Deputy Speaker, and thank you very much, Minister. In terms of the barriers to the recruitment and retention of pathologists, what do you see as I suppose the biggest barriers in terms of that skills deficit there seems to be with paediatric pathologists at the moment?
Minister.
Well, I thank the member for her supplementary question. I believe it is just not proving to be an attractive profession. And as I said, this is not just for us. I think we had 2 paediatric pathologists who both retired in recent years. We have made several efforts at recruitment unsuccessfully. And as part of our research into that, it has been made clear to us that it's not a Northern Ireland problem, it's not even a UK problem, it is a global problem, and so everybody is tending now to specialise. Alder Hey is being asked to absorb more work elsewhere from beyond the northwest, the Liverpool area. They're content to continue with us. Our deal lasts well into 2027. Hopefully that will be enough time for us to work with the Government of Ireland to see if we can bring in a new service. But it just seems to me it's just not a particularly attractive line of work within healthcare.
Thank you, Minister. I call Doug Beattie for supplementary.
Thank you, Madam Principal Deputy Speaker. Like the member who asked the question, I'm glad the Minister has recently met his Irish counterpart. Can the Minister detail what support is actually out there for bereaved families?
Minister, you have a minute to respond.
Right. I thank the member for his question. And the answer is a lot of work has been undertaken in partnership with key charities and also with families who have been affected by bereavement. And that's because we want to ensure arrangements are as sensitive and dignified as possible. So we've been listening. Thorough oversight continues to ensure any baby or child who requires a hospital-consented post-mortem, as well as their family, that they're all treated with the utmost care, respect and compassion.
Thank you, Minister. That ends the period for listed questions. We'll now move on to 15 minutes of topical questions, and I call Colin McGrath.
Can I ask the Minister to detail the engagement that the Department has had with NIPSA regarding social work engagement as part of the mental health order duties, especially in the Belfast Trust?
Minister.
And I thank the member for a very detailed question to which I am not in a position to answer, as I may well have suspected. I'm sure he thought the Minister was waiting for a question about ambulance services and W45, so you've got me.
Colin for supplementary.
Thank you very much, Minister. Would the W40... No, I'll go stick to... what assurances can the Minister give that the resources up to and including inpatient bed facility will be available to social workers that are undertaking mental health order assessments? And will you intervene urgently to ensure that the action that is suggested by NIPSA from Wednesday can be averted in the interests of everybody's public health?
Minister.
I can guarantee to the member that I will go away and look at this and engage, certainly at official level, with NIPSA, and I'm more than happy to meet with the member and discuss it one-to-one.
Thank you. I call William Irwin.
Madam Principal Deputy Speaker, can I ask the Minister, he will be aware of the concerns around ancillary care, most particularly in rural areas where many cases it's difficult for care packages to be administered. What plans has the Minister to improve the delivery of care packages, particularly in rural areas?
Well, I thank the member for his question. He will be aware that over the course of the winter that the flow through our hospitals was not as it should have been, and while the focus was on emergency departments, that's only where the problem was manifesting itself. The problem was actually at the back door, getting patients who were medically fit for discharge either into a care home bed or to provide for them a domiciliary care package. On Tuesday of last week, we had what I believe a very successful, certainly a very well attended opening session in terms of looking ahead to the winter of 2025. Around 120 people in the room, all professionals with things to say, and a waiting list. So we're going to be working on that over the course of the next few weeks. And in terms of trying to make the profession more attractive, I have committed to introducing the real living wage for social workers during the course of this calendar year.
William Irwin for a supplementary.
Can I thank the Minister for his response. The Minister will be aware, and he has touched on this, at any given time there's between 500 and 600 beds being occupied by patients that are deemed fit to be discharged. Would the Minister agree with me that delivery of care packages is key to addressing the bed shortage in our hospitals?
Minister.
I think there's a cocktail of reasons why we have 500 to 600 people at times. Certainly in the early days of January, that was the figure in terms of our acute hospitals. And I think if you delve into that cocktail, yes, beds, step-down beds, care beds, domiciliary packages would be top of the list, and that's why I am putting a focus on that together with colleagues as we look towards the winter of 2025.
Thank you, Minister. I call Stephen Dunn.
Thank you, Principal Deputy Speaker. Minister, in response to a recent written question, your predecessor advised me that a new urgent care centre within the Ulster Hospital would be opened by late January 2025. And a response issued by your department to a subsequent question has advised the centre will now open in June. Can you please provide me with an update as to when this new urgent care centre within the Ulster will be open?
Minister.
I thank the member for his question. As he's aware, the minor injury unit at Ards and also the minor injury unit at Bangor are making way for this urgent care centre, which will be placed in the curtilage of the Ulster Hospital. Indeed, it will be adjacent to the new emergency department. I had the pleasure of visiting it some months ago. It is currently under construction. The construction is due to be completed. Currently, the date for completion, I believe, is March of this year, and then there'll be a short commissioning process to be gone through, and it should be fully operational by June.
Stephen Dunn for supplementary.
Thank you, Principal Deputy Speaker, and thank the Minister for the positive answer, and we certainly look forward to it coming. As you've said, the Bangor and Ards MIUs, the rationale was that this will be coming. I suppose, can you assure my constituents that there will be no further delays to the opening of this much-needed facility, given the pressures around the corner in the emergency department, which you will be well aware of, as well as the frustrations around public access to our GPs?
Minister.
Well, I can't give the member an absolute guarantee that there will be no further delays because I can't look into the future, but what I can say to the member is I am not aware, I have not been briefed in terms of any potential hiccups or banana skins between now and the completion and the commissioning of the Urgent Care Centre. I believe it's a very positive move. It will be open 7 days a week, it will be open 12 hours a day. As I say, it's right adjacent to the emergency department, but let's not forget it's also on the site of an acute hospital, so things like scans and x-rays and all the other facilities that you may need will be within arm's reach. So I think it is a very, very positive development. I know some people resisted the move from Ards to the Ulster Hospital, but I have to say we're talking 4.6 miles on a dual carriageway, so I don't think it puts enormous pressure on people to ask them to travel a short distance for better care.
Thank you, Minister. I call Doug Beattie.
Thank you, Madam Principal Deputy Speaker. The Minister will be aware of some media reports today in relation to and concerns around toilets and changing facilities in the 5 health trusts. Can the Minister give a commitment that he will task his officials to work with the trust to urgently engage in regards to this matter?
Minister.
I thank the member for his question. Yes, media coverage today relates to existing gender identity and expression policies in the Health and Social Care Trusts. In relation to changing of toilet facilities, these refer to putting in place arrangements which everybody is comfortable with and which also respects everybody's dignity. That, of course, is the ideal and probably easier said than done. Achieving it is going to be the challenge, and we're dealing with conflicting rights in some cases. More widely, the whole issue of trans rights has become wrapped up in what I believe is quite a toxic online culture war, where any notions of sensitivity and respect have been totally abandoned. I very much understand the argument for single-sex spaces in certain circumstances, but I also want the health and social care system to be a welcoming and a supportive place for everybody who works there, regardless of class, creed, race or identity. I understand gender identity policies are under review at a number of the trusts, and that will be an important process. I'll be seeking more information on that and what else may need to be done to provide greater clarity and protection.
Doug Beattie for supplementary.
Thank you, Minister, for your clarity on that. But can I just ask, does the Minister agree that it's important to take on board as many views and concerns as possible in developing such policies? And on that note, can I welcome his recent agreement to add the Northern Ireland branch of the Women's Rights Network to his department's consultation list?
Minister.
I thank the member for his supplementary question, and yes, I absolutely agree. I think we have to start from a position of respecting everybody as an individual. Every individual has rights, every individual has views, and they should be listened to respectfully. And I think that is the case in this, as with anything else that we deal with in this chamber. And I think back to 1998 and the very first commitment in the Belfast Good Friday Agreement, which was a fresh start in developing relationships. And we're going to have to develop relationships with people and make sure that we are offering them the best that we can possibly offer them. And I think on this specific, part of the way forward may involve the development of single-use and stand-alone facilities that can be used on an individual basis, and that again is regardless of gender, regardless of that view, but to be done with privacy and with respect.
Call John Blair.
Thank you, Principal Deputy Speaker. Can I ask the Minister what engagement he has had with the UK Government around the pending Hillsborough Law?
Minister.
I want to thank the member for the question. Yes, we have had, I think, significant and ongoing engagement with the UK Government over the Hillsborough Law, and it falls into a broader set of policy considerations that are currently underway. I think the member may be aware that we're currently consulting on a being open framework. I have also made a commitment to look during this mandate at the possibility of a duty of candour on an organisational basis. I know a significant number of members of this House would also like to see a duty of candour on an individual basis with criminal sanctions. And I have to say again, I think that's a very negative way in which to phrase the concept. And the Hillsborough law will play into that. So there's quite a complex picture developing, and I just assure the member we've got a real focus on this, and we are liaising constantly with the UK government about their proposals, which will be coming in a short number of weeks, remembering the Prime Minister promised to publish a bill before the next anniversary of the Hillsborough disaster.
John Blair for supplementary.
Thank you, Principal Deputy Speaker, and I thank the Minister for that answer, because you see the hyponatremia-related deaths, Muckamore Abbey, abuse allegations, a neurology scandal, infected blood scandal, and much more have demonstrated very clearly the importance of having robust mechanisms in place to ensure honesty and transparency when things go wrong in health and social care. So can I ask the Minister if he can commit today to learn from these tragedies and play his part in delivering statutory, individual and organisational duties of candour in public services in Northern Ireland, for which he has responsibility?
Minister.
I can certainly promise the member that I am determined that we all in health and social care delivery learn the lessons, and the member has given us a long list, a very long list to my mind, of where things have gone wrong, and I certainly don't want that list to be added to on my watch. I would just gently say that in terms of the one specific of a duty of candour on an individual basis with criminal sanctions may have a deep chilling effect on both the recruitment and the retention of essential health and social care staff. And I just again ask the House to reflect on that. We're all constituency MPs. In every constituency we have allied health professionals, we have nurses, we have doctors. Speak to them, listen to them, ask them what they think the impact of that individual duty of candour with criminal sanctions might have on healthcare delivery going into the future.
Colin Gildernew, please.
Minister, could I ask that you provide an update on the restoration of the cross-border healthcare scheme, given pressures on health and recent allocation within the programme for government, or increases?
Minister.
Well, I thank the member for the question, and the cross-border reimbursement scheme remains, I think, just enduringly popular, certainly judging by the correspondence I get from members of this House, among others. Personally, I would very much like to reintroduce it. The member talks about the programme for government commitment. I have to say that commitment is qualified, because if you read what it says about waiting lists, it says given executive support, we will get some money, and it also says up to 135 million. It doesn't say 135 million. So what I am hoping for is the other 80 million, which is there to make sure that the waiting lists don't get any larger, that will be forthcoming, because I think it is key to try and stabilise those waiting lists by not allowing them to become any bigger. The 135 was to start reducing the waiting lists, and as I said before, we would need to spend that 135 5 times. It's over 5 years. I am not at all confident that 135 will become available during the course of financial year 25-26. I'm seeking clarity on how much I can expect to get. I'm also seeking clarity on when that money may start to flow. But I am instinctively thinking that what I should do is proceed at risk. And that means thinking about a cocktail of new initiatives, talking to the trusts, talking, whether members like it or not, to the independent sector, but also thinking about reintroducing that cross-border scheme.
Colin Gildernew for a supplement.
And Minister, you know that all of us, both as users of the health service and as the health service itself, have also lost access as a result of Brexit to the wider European scheme. Is there any work ongoing to see if we can restore access to that scheme?
30 seconds to respond.
I think I can respond pretty quickly. I think the answer to that is no, we have not. But we are tending, because of the pressures on the budget, to work hand to mouth, day to day, living in the day. And what we need to do is try and lift our heads up, difficult as it is, and start thinking a little bit more strategically. And if there is more money coming, we will look at all the options, because if there's a lot of money coming, can be difficult to spend in a timely manner, and that's why we need a cocktail. And I'll certainly look at that, but I think the cross-border scheme is the one to go with.
That ends questions to the Minister for Health. Colm Gildernew has given notice of an urgent oral question to the Minister for Communities. As Minister Lands is not available to respond, I've been